Good afternoon. Thank you all for being here. I want to first start by thanking residents and businesses throughout the entire city of Philadelphia. The restrictions that we announced yesterday are difficult for everyone, but necessary. And I can tell you that the great majority of folks have been understanding and cooperative. We are working very hard to balance the importance of vital health precautions with the desire to continue life, including business activity, as much as possible. We are working very hard to answer the enormous number of questions that businesses and residents, and of course those of you in the press, have about what should be open and what should be closed. I want to thank members of the press for your patience as we adjusted the location of these daily briefings back to City Hall. We did so because the space here is bigger and better for social distancing precautions. We are also working on moving this briefing to virtual to remove the need for press to come in person and still ask questions remotely. So we appreciate your patience as we work through that also. And we are working hard to roll out the business relief opportunities that our Commerce Director discussed yesterday. I also want to thank our city workers who are continuing to perform their duties in the midst of this pandemic. This includes sanitation workers, members of the Philadelphia Department of Public Health, and firefighters, police officers, and others. And of course, this includes members of the Philadelphia Police Department who are not only coping with a health crisis in a job that puts them in direct contact with the public, but are also still very much coping with the tragic death of Corporal James O'Connor. I thank all city workers for your efforts during this period. I am confident all of us will pull through this because we are strong and we are resilient. Now I will turn things over to Dr. Farley, who will update us on the latest cases.
All right, thank you for coming. So first I want to update you on case counts, and then I want to update you on testing and some general health department recommendations. First, as of 8:15 this morning, the state of Pennsylvania had posted on their website that for the entire state there were a cumulative of 63 cases of COVID-19 coronavirus identified in the state, of which 30 were from Montgomery County, 7 were from Delaware County, and 5 were from Bucks County. Today, since the last time we briefed you, 1 p.m. yesterday, there have been 9 new cases of COVID-19 coronavirus identified in Philadelphia, bringing the total case count in Philadelphia since the beginning of this to 18. I can't give you details on the individual cases. Many of them we just learned about this morning, but I can tell you that at least some of them did not travel internationally and had no known or recognized contact to another unknown case. So we do know that this virus is circulating in the community. That's what we expected. That is definitely what is happening now. We have an additional 70 people who have been tested that we know that their test results are pending, and we'll learn about in the future. We have 114 people who are identified medium or high-risk contacts to the cases that we have identified who are being monitored at home or in the process of being notified to be monitored at home. One of our long-standing interests here is to increase the number of people who are tested. So we received 99 test results this morning, so that number is increasing every day. And I want to emphasize still to doctors that we want doctors to test more people. Most of those tests will be negative, and that's okay, but we need to test many negatives in order to find the few positives that are out there so that we can help make sure that that chain of infection stops. Now, we have good news today about the availability of testing increasing. A number of healthcare systems have set up rapid test sites in the community. University of Pennsylvania has 2 sites, one of which is in West Philadelphia, one of which is in Radnor. Temple has 1 site, I believe on their main campus. Jefferson has set up 2 sites, one in Center City and one in Abington. And the Children's Hospital of Philadelphia has 1 site near its West Philadelphia campus. Cumulatively, these sites tested approximately 200 people yesterday. That's a very rough number based upon a conversation we had earlier this morning. Other providers are opening test sites as well, and there's more to come. So this will be improving every day. So we want people to know in the city of Philadelphia, if you have symptoms and you feel like a test is appropriate, contact the provider who was the last one that provided care for you. So if you saw a doctor affiliated with Jefferson in the past, contact your Jefferson provider. If you were taken care of by Temple in the past, contact your Temple provider. The reason is that each of these health systems is using their own electronic health record to register patients. And if it's a known patient to them, then that's a very rapid process to simply update that record. If it's a new patient, then it's a very lengthy process, and they want to move patients through quickly. All of this testing is done at no cost to the patient. Okay, no copays, no coinsurance, no deductibles. All this is at no cost to the patient. The only reason we are directing people back to the provider that they're familiar with is to speed up the registration process. We recommend that people do this if they contact their provider, if they have symptoms that they feel are compatible with the COVID-19 infection. And just to reiterate what we said before, the two most common symptoms are fever and a dry cough. A large study done in China about all the people who had this infection, about 70% had a fever, about 70% had a dry cough. The next most frequent symptom was fatigue. When I say fatigue, I'm not talking about being tired, as we all are tired these days, but rather the excess fatigue that you feel when you have the flu and you really feel tired enough that you just want to go to bed. So that's the third symptom to look for. Symptoms of a runny nose and sore throat are uncommon in this infection. Only 5% of people with this infection have a runny nose, and only 15% have a sore throat. So if you have a runny nose and a sore throat, you probably do not have this infection. You probably don't need to be tested. So look for fever and a dry cough. And to be clear, we do not recommend that people be tested if they don't have any symptoms. If you don't have any symptoms, you will probably be negative. That may give you a false sense of security. Even if you were exposed to this virus 2 days earlier, you may test negative because you're incubating the infection, and it may turn positive later. So we only recommend this testing for people who have symptoms. So look out for those characteristic symptoms. Then I just want to remind people what they need to do to keep safe. We can't say this often enough. Keep your distance from people. When we look for people who are contacts at high risk, we look at how long people have spent within 6 feet of another person. So the more you keep people at distance from each other, the less likely you are to be infected. Wash your hands. Use alcohol-based hand sanitizer. Don't shake hands. Don't hug. The simplest way to stay away from people is to stay home. So we want to remind everybody, if you are employed in a job where the business is still operating, but you can work from home, work from home. Now, we understand all this is inconvenient, but it is important. If you do this, you're protecting yourself, you're protecting your loved ones, and you're protecting the entire city of Philadelphia. The fewer people who have infected, then the fewer people who will get infected. Now, all of this is true for everyone. It's especially true for anybody who has a fever or a new onset of a cough. Stay away from other people. Now, just a reminder, for people who have questions about these clinical symptoms, who want information from a medical professional, you can call our 24/7 hotline, 1-800-722-7112. That's for people who have questions about the virus itself or about the disease. It's not for questions about whether you think a business should be open. I know there's many questions about that. This is for clinical information. So that's a medical update. I'll now turn it over to Managing Director Brian Abernathy.
Thank you, Dr. Farley. First, I want to provide some clarity on the business activity restrictions that we announced yesterday. As the mayor mentioned, even with the long list we provided, there have been a lot of very understandable questions from small businesses, including those who may not fit neatly into a single category. We are working through those questions. The authority to impose those restrictions is contained in an order released by the Health Commissioner, and that order has been distributed to all of you and is being posted online. We believe that order will answer the majority of questions that we've received. We've also will be posting blogs and an FAQ on the phila.gov website that further clarifies the delineation between essential and non-essential services. And we ask for folks to be patient as that goes live. If small businesses do have questions, we're asking for them to email vbeoc@phila.gov. That's virtual business at the Emergency Operations Center at phila.gov. So again, vbeoc@phila.gov. And remember that if anyone sees someone in violation of these restrictions, they should call 311. And complaints will be referred to the health department, and licenses and inspections depending on the nature of the business. 311 is staffed during normal business hours, but certainly people can leave messages after hours, and we do intend to extend 311 hours this weekend. I also want to update you on city services, as the last 24 hours has allowed us to better clarify what services will be impacted by the new restrictions. As we mentioned yesterday, individual department heads have been working with their staff to determine which employees are deemed essential. As the mayor indicated, we want to thank the thousands of city workers who have been working tirelessly to help Philadelphia through this period. Again, essential city services will also be posted online in the near future. We've had a number of complaints around price gouging. That is actually regulated by the state's Attorney General, and so we would ask the public to refer complaints to the Attorney General by sending an email to pricegouging@attorneygeneral.gov. Again, that's pricegouging@attorneygeneral.gov. Again, I want to remind the public to text 888-777. This is backwards, I apologize. I want to remind the public to text COVID PHL to 888-777. Again, that's COVID PHL to 888-777 for text updates. That list is growing past 50,000, and we're counting on that message to really get word out as we go on. And with that, I'm going to turn it over to our friends at SEPTA, Scott Sauer, who is Assistant General Manager for Operations.
So yesterday, we announced that we would reduce our regional rail service by 25%. We did that effective today. We reduced our regional rail service from a weekday total of 769 trains to a total of 581 trains. We've done this for a variety of reasons. We've seen significant ridership loss across the entire system. We are also looking for ways to provide our employees with an opportunity to distance themselves and take care of their personal and family needs during the crisis. We expect that there would be disruptions in service from time to time, and we have activated our Emergency Operations Center to monitor service on a daily basis, and we are doing so. Today, we had no disruptions due to any attendance issues. We had no significant disruptions of any kind, but we do expect that as conditions change, we would implement further service reductions across the board to include city bus and subway services as well. Our service planning and operations teams are working towards that end. We expect to have something perhaps by the end of the week. I would simply like to close by thanking our employees. Our employees have done a magnificent job coming in to provide very critical services. Our mass transit service is critical to the region, critical to the city, to not only take hospital staff, medical staff back and forth to provide those services, but the housekeeping support and dining support at the hospitals, as well as all the critical services that have been identified to remain open. We provide a means for those employees to get back and forth to those jobs. And certainly our service is there to provide a way for people to get to those critical services, whether it be grocery stores or pharmacies. So SEPTA employees have really stepped up, done a fantastic job to keep the service running. For any information related to service on a daily basis or any changes, I'd refer our customers to our website, to our app, or to our Twitter feeds. Thanks.
Thanks, Scott. And just on behalf of the rest of the city, we appreciate SEPTA's leadership on these issues. You really are the lifeblood to make sure that our workers get to work safely and on time. With that, I want to turn it over to Scott Petrie with the Philadelphia Parking Authority.
I want to thank the mayor and Mr. Abernathy for giving me the opportunity to present information. I know many of you have questions, and we're here to try and answer the role that the Philadelphia Parking Authority has in this crisis. I'm Scott Petrie. I'm the Executive Director of the Philadelphia Parking Authority. We're passing out a detailed information sheet which will provide information on how to pay tickets online, how to retrieve impounded vehicles, and other important information that citizens will need. Before we talk about any of the details, in the event there are questions, let me just talk about what I believe is our role as the Philadelphia Parking Authority. Our role is to assist in this crisis, to try to manage safety issues and the like, and to try to ensure that folks will have access to their critical needs they have. So in that light, I would ask that we all be considerate of our neighbors, our friends. We try not to park in parking spots all day long. Try to especially pay attention to areas where there are food stores, where people need to get their staples, where they need to get important medical services, etc. So I think it's really important that we be considerate to one another. As far as the enforcement role, a special emphasis will be placed on enforcement of safety violations, including blatant violations that cause a threat to public safety or cause the delay of emergency services being provided, such things as double parking, parking in loading zones, and blocking entrances or crosswalks. It's essential that motorists park legally so as not to impede the delivery of services and the ingress and egress out of our city. Additionally, meters, kiosks, and residential time limits will not be enforced. We're all in this together. Please think about your neighbors. The handout provides more detail, and if you have questions, we can answer them at the end of the presentation. Thank you.
Great. Thank you, Scott. I did one other quick update that I just received was that we have the schools have distributed 5,000 meals today, as well as education packets at 30 different locations. That does not include the recreation centers that are also distributing meals, and we expect a broader food distribution plan to be available later this week. Before I take questions, I want to thank our council colleagues, council members Gilmore Richardson, Brooks, Thomas, and Squilla. Thank you all for your support and for your leadership on these difficult issues. And with that, we're happy to take questions. Sure. So we are working very closely with the Department of Community and Economic Development at the state, our partners at the Philadelphia Industrial Development Corporation, and the Commerce Department to develop a business support program. We, as indicated yesterday, we hope to have details of that program towards the end of this week. And I also understand that the President also just announced a business support program. I don't know the details of that program today, but that is, I think we recognize the huge disruption that these closures and this crisis is having on our small businesses and our workers. I touched on this yesterday. We have to make sure we have safety nets in place for those workers and for those businesses. It's one of the reasons we waited a little bit of time before we announced these closures, was to make sure we had some supports in place, whether that's food access, the governor's efforts to streamline unemployment. All of those things are going to be vital as we look to recover from this crisis going forward.
And we're going to do everything we can within our means. But this is a national issue, and it's going to have to be a nationally addressed, similar to World War II or to a depression. They're going to have to step up, both the federal, state, and we will also. But we cannot toe this entire burden on the city. This is a national issue, and we're expecting our national government to do what they're supposed to do and make sure that we're whole.
What conversations are you having, or is it still too early?
Our federal lobbyists are doing their job. We're interacting with our U.S. Senate delegation and our congressional delegation, and there's really nothing that's finished at this point yet. But I just want to, in the big picture of things, this has got to be a national effort to get ourselves economically back on track.
Dr. Farley? You spoke about there were people who have not traveled in foreign areas,
Right.
and you're saying the virus is spreading. Is it true that one of the people that is the new infectee was a food service worker in Kensington?
Yeah, I don't have any details on individual cases.
Also, I'm sorry. You go ahead.
We've heard that testing burns through supplies like masks and gloves. So when you call for new testing, do you have any concern about using up supplies that may be in, limited quantity?
We are worried about that. You need personal protective equipment for the people who are working on testing. You also need the supplies. It's called viral transport media. Those are kits where you collect the samples with. We're seeking additional supplies, but at the same time, we do think we can increase the testing from where we are right now.
Okay, and a lot of people are asking about the geographic areas. I know in the past you haven't wanted to say, but could you give us a rough idea of the geographic areas in which the positive cases are?
I can just say they're all over the city. Yeah. And this virus isn't going to stay in any particular neighborhood. As you can tell, it's all over the region, all over the country, all over the world.
We also touch on unemployment for a second. I'm also getting some questions from my newsroom also. At this point, where are we at with being able to assist the people that are going to be out of work? Are there going to be anything in place that can be specific to being out of work because of COVID-19?
Again, the governor announced some streamlining of unemployment compensation yesterday. We are continuing to work with him to improve SNAP benefits as well as TANF dollars to provide additional support to our workers. We've stood up. We are standing up food access points throughout the city, and we'll continue to provide what support we can. To the mayor's point, this is not an issue that the city can handle on its own, and we're going to need to work with our state and federal partners to be able to drive it forward. Again, the Congress is working on to finalize a package of relief that we hope will provide significant help, but the details of that package are yet to be known. All right.
Can we get some clarification on the number of cases in Philly? According to the state's website, they have 10 in Philly. You guys just announced 18.
Right. The state's website lags a little bit behind the information that we have, so we're up to a total of 18 now.
Okay.
I have a question for Dr. Farley. Dr. Farley, can you tell us exactly what the hospital capacity is in Philadelphia?
I don't have it for you right now. I know there is a certain number of beds that each of them have, but then there's an ability to expand those beds through a variety of regulatory measures and actions within the hospital.
Why can't you tell us exactly how many beds there are?
I can get back to you with that number. I just don't happen to have it with me right now.
Is there, because we're talking about flattening the curve, right?
Right.
That's been said over and over and over.
Yeah.
What is the maximum capacity? How low do we have to get the curve?
I don't have that answer for you. I can try to get a better answer for you, but I don't have it right now.
Can I ask how many of the cases have been hospitalized?
I'm sorry, can you repeat that question?
How many of the cases have been hospitalized? Any?
As of yesterday, only one that we're aware of was hospitalized. Of the new 9 ones, I don't have that information for you. We'll follow up with that.
I have one question for Commissioner Farley and one for someone else from the city. In terms of symptoms, why are you recommending that people not get tested if we know that you can be asymptomatic?
Because if you test, let's say you were exposed to this yesterday, and you test today, you're going to test negative. You may still be incubating the infection, and you may develop symptoms 3 days later. That negative test may give you a false sense of security that you're fine, and then you should go out there and come in contact with people. If you're exposed, you need to stay quarantined for 14 days. So during that quarantine, if you develop symptoms, that's the time when we know the test would give you an accurate result, and that's when you should be tested.
So specifically, the test will not be accurate until you begin showing symptoms?
It certainly may be inaccurate up until the time you show symptoms.
Gotcha.
You may have false negatives, to be specific.
And then in terms of development sites, construction sites, are there any regulations from the city on whether people can continue to work on construction sites?
The order that was distributed today clearly says that construction is considered essential, and the governor's order, governor also declared construction sites essential.
Okay, thank you.
afternoon. You alluded a little bit yesterday about what the city was trying to do in terms of homeless populations. What is the progress on that, and where can people who may be homeless or know of homeless people, where do we direct them to? Where do we direct these folks to?
So just like any other day, people should call Homeless Outreach, and which number I do not have but we can certainly get that for you. 215-232-1984. Again, that's 215-232-1984 for Homeless Outreach. Our homeless outreach providers are still active, and we are working on building capacity to make sure that there are additional beds available. We are making progress similar to the quarantine sites. We are touring a number of sites to be able to identify appropriate locations and hope to be able to secure those sites in the next week or so.
Okay. Also, in terms of and it just went right out of my head. In terms of the people who are homeless, for want of a better way to put it, a lot of these organizations that work with them are also staffed by volunteers. Are volunteers for organizations that are helping people try to get through this considered essential services? Are these folks still allowed to do their volunteer work?
Absolutely. Social services are going to be needed throughout this crisis. We hope that people continue to volunteer, and we have heard from a number of our social service agencies that volunteerism has dropped off. I think we're cautiously optimistic that some of the city's non-essential personnel will volunteer, and certainly some of those individuals who are working from home, whether that be professional staff at an accounting firm or whether it's a teacher, that they also volunteer for these social service agencies. This is a crisis that's going to take all of Philadelphia to come together and drive past our fear and lift one another up if we're going to make it through. While we have to promote social distancing, we also at the same time have to recognize that our neighbors are going to need us, and we're going to have to offer ourselves.
And I just have one more quick question for Dr. Farley. There is no established one particular antibiotic cure for this, right?
Correct. There is no specific treatment for this virus.
Okay.
And antibiotics do not kill viruses in general.
Okay, well, that's why I'm a journalist and not a scientist.
Right.
But what are you treating people with who have tested positive to make sure that they don't get really, really sick?
Well, most people who get this infection have a mild illness, and they can stay at home and they recover on their own. Percentage of these people get severely ill, and the illness that is the aspect of the illness that's the most dangerous is the infection in their lungs. And so, for example, you can give them oxygen to make it easier for their lungs that are not functioning fully well to get oxygen into the blood. That's that kind of supportive care that you can provide. It doesn't kill the virus, but it helps the body tide it over until the body can fight off the virus.
Dr. Farley, we've heard that the state might be trying to set up a test site in Philadelphia. Do you have any information on where that would be, when it's coming, who would be able to get tested there?
I'm not aware of the state setting up a site in Philadelphia. There is a site that we are working with a variety of partners, and the state has been involved in it. And I don't have information on that site yet. I'm hoping that we will have more information in the next 2-3 days on that.
Okay, given that liquor stores are closing tonight, is the city making any plans for treatment of those with alcoholism who could go into severe withdrawal and have medical consequences for that? This isn't a question of where can people get liquor, but for those with an addiction.
Yeah, so, alcohol is still available at a lot of stores in the city. Liquor stores are not the only place you can get alcohol. There are other stores as well you can get it.
Okay, and a question for the PPA, those enforcement changes, is there a time period attached to that?
Yes, thank you. Those provisions, those enforcement have already started. So there's a softening of enforcement. Again, the goal is to be able to allow emergency providers and access for residents. So it's a relaxed enforcement and actually began yesterday.
Okay, and a question for Brian. The
jail, we've heard that there are perhaps sections of the jail that are quarantined. Can you comment on that?
There's no sections of the jail that are quarantined at this point. We have restricted visitation, so we're not allowing visitation at this point. We do have areas to quarantine inmates should they show symptoms or come in with an acknowledgement that they've been exposed to the virus. So we're prepared in that eventuality, but at this point, at least as of a couple hours ago, no one was in quarantine.
Okay, and one last question. Have you had to enforce business closures at this point where you heard of someone not complying and you had to go out and tell them to shut down?
No, we have not enforced. We understand that this is going to take some time to get used to. I think even when it gets time to enforcement, I think we're going to issue some warnings. We're going to encourage folks to shut down on their own. I frankly believe in Philadelphians generally, and I think for the most part people are going to shut down voluntarily and with a warning.
For city workers, either if they're full-time, part-time, temporary, seasonal, are they still getting paid if they have to stay home during this process?
Yes, full-time workers are receiving what is called excused time or e-time, and so they will still be paid. We are working through details of our temporary and seasonal staff. We have the same concerns that you have, and we need to make sure that the appropriate regulations are in place so that we can support those workers.
A lot of people were laid off in the last 24 hours. What should they be doing right now if they don't have an income coming in?
They should register for unemployment benefits as quickly as possible.
And any other thing they should be looking out for?
They should certainly be aware of the food access sites that we have stood up. That, again, there will be more information towards the end of the week on that. And I think this is a rapidly evolving situation on the federal and state level as well. And so I think our hope is to be able to provide more specific guidance for folks as that guidance becomes clear. There are also some industries that are having to hire. I believe Amazon has announced that they are hiring a number of individuals for delivery services essentially as well. And so I think we are trying to work through what resources we can point people to as well to try and keep as many people employed as possible. But we recognize that the unemployment rate is going to go very high very quickly.
Do you have a rough number of how many people? Okay. And Dr. Farley, you mentioned community spread. Did you say where that's happening?
No, I'd simply say it's in Philadelphia. I didn't say a specific neighborhood, but nobody should think that it's in that neighborhood and not my neighborhood. Let's assume that this virus is everywhere in the city. That's why everybody needs to take these precautions.
Why not say where this is happening?
We're trying hard to protect the privacy and confidentiality of individual people. And it's not information the general public need to know that it's in this neighborhood versus that neighborhood. As I said, everyone should assume that it's everywhere.
Okay, thank you.
Clarification for PPA. Will metered parking stop? Is that something that will take place?
So again, there's no enforcement at the meters for the time period that the mayor has established this crisis. Having said that, please be respectful of the need for people to access those spots. Don't think of it as I now own this spot and I'm not moving. That's not going to be helpful in delivering services. If we find safety violations, we're definitely going to enforce those, and you could be towed. But at the meter, we have suspended collecting revenue.
Question for the mayor: could you put a dollar figure, by any chance, on the potential economic impact of all of these measures?
No. I mean,
it's devastating.
How long is it going to? I mean, how long is it going to last? We've done 2-week chunks. Could be 4 weeks. Could be 8 weeks. Could be longer. Hopefully not. But we're monitoring the situation and we're trying to develop models. But we don't have a specific answer for you at this point. It's not good. So.
Dr. Farley, I have a question about air pollution. This might be an unexpected bright side in some degree. With all the cities shut down, do you have any thoughts on how this could impact air pollution?
Yeah, I expect our air pollution levels will probably go down because the number of vehicles on the streets is less, and we know that vehicles are our biggest source of air pollution.
Thank you. And then one question for the mayor, last question. You kind of addressed this, but does the city have any thoughts on how this could impact our taxes, a revenue for the city and any projections at all on the city's budget?
Not at this point. We're in like day 3 or 4 of this. It will have an impact. A lot of our tax revenue is in already. Real estate taxes, for example. There'll be obviously business tax consequences and wage tax consequences potentially. So Rob DeBoe is very good at finding those numbers, and we'll have a better idea as to where we are as we get closer to the end of this.
Thank you.
You're welcome.
Dr. Farley, between yesterday and today, the positive tests have doubled. We have asked about the beds. We haven't really gotten a concrete answer. Can you assure the people of Philadelphia that hospitals are ready to take people in if these tests keep doubling and tripling within the coming days?
So let's be clear, across the whole country, across the whole Western world, if this spread goes unchecked, the healthcare system will be overwhelmed. Okay, that's just simply a fact. That's what's been experienced in China, that happened in Korea. The reason we're taking these measures now is to try to prevent that from happening, to try to prevent it from being unchecked. The hospital capacity is only so much, and if you have a huge number of people get sick at one time, that will be overwhelmed. I can say that again, we're trying to reduce the number of people who ultimately need that care. I can say that all the hospitals in the city are going to be taking every step they can to try to maximize the resources they have available to them. We need to do that and take these serious steps now.
Thank you.
Mr. Mayor, I'm curious what you think about some of the comments that other executives have made about hospital capacity. Governor Cuomo has said that New York State, for example, will likely exceed its hospital capacity. Do you have any concerns about that in Philadelphia?
I have concerns about everything. I have concerns about this particular situation, violence, other issues that are plaguing the city. I don't know what Governor Cuomo is basing that on, but I take him at his word, and I don't have an answer for you at this moment. I do know that we have one of the best hospital systems in the world. If you look at Jefferson and Hupp and CHOP and Einstein and all the hospitals that we have here, they do a terrific job. They're staffed and run by extremely competent people. They know what they're facing, or they're anticipating what they're facing, and they're going to do their best job, I have no doubt. And we may have to do other things outside of hospital, setting up other types of situations for people to be at. As we're getting to that bridge, if we see it coming, we'll adjust and work with our hospital partners to do the best we can.
Have you or your staff asked questions about what Philadelphia's hospital capacity is, and what were the answers?
That question is difficult to answer because every day the hospital census is different. So if there's a surge while there's a large population of people in a particular hospital, they're going to have less beds. If they can get people better on other illnesses and get them out and empty those beds, they'll be available. So it's kind of a fluid situation.
If I could add to that, I believe what happened in New York was that they enacted some regulatory changes that enabled hospitals to put more beds in an existing facility. My understanding is that the state of Pennsylvania will be taking similar actions, perhaps as early as today, to make regulatory changes that essentially increase the total bed capacity. But the other point is that there's a number of licensed beds in the city of Philadelphia. Then there's a number of beds that are occupied by people. The percentage of beds that are currently occupied in Philadelphia is much lower than it is normally. It may be about the lowest it's ever been because elective surgeries have been canceled. The hospitals are anticipating a surge and trying to draw down the other patients so they make more beds available. That's one of the many steps they're taking to try to address that surge, in addition to this increasing that total capacity.
Mayor Kenney, do you view the city commissioners in preparing for the primary election as essential? Should they stay open? And also, do you think that the primary election should be postponed?
At this point, I don't have a judgment on that. We'd have to see where we are at the point in time when you have to make the decision. I don't have a crystal ball, and I can't tell you what exactly is going to happen in this upcoming primary. But we'll consult with everyone involved and make that decision when it's appropriate. I think it's too early to make it at this moment.
I will just add, Laura, that we are working actively with the city commissioners on contingency planning around the election, should it not be postponed, and feel confident that with our resources and with strong coordination, we can be ready should the election continue.
When talking about if there's enough room with hospitals and everything else that Mitch was asking, we also want to know about the PPEs, the personal protective equipment for workers at city public health clinics. We're getting word from people that there just isn't enough of that type of equipment. I don't know if that's the same equipment that also first responders and emergency personnel would use, and is there enough of it?
Currently, there is enough personal protective equipment for the workers at the city clinics. If this goes on for a long time, if there are many patients to have to deal with, we are concerned about that availability. There's a limitation of this across the country. Currently, there is enough.
Great. Thank you.